The views and opinions expressed on Senior Scoop with Bob and Maria, presented in partnership with Caregiver Volunteers and Harrogate, are for entertainment and informational purposes only. These views do not necessarily reflect the opinions or policies of Caregiver Volunteers, Harrogate, this station, or their affiliates. The content provided should not be considered medical, legal, or financial advice. For personalized guidance, please consult with a licensed professional. Listener discretion is advised.
It's time for the Senior Scoop with Bob and Maria.
Well, welcome everybody. It's the Senior Scoop. We are here. It is our June episode here, and it is Alzheimer's Awareness episode. Welcome back, Maria.
Thank you.
So how was your vacation?
My vacation was so good, I need another one.
It's always that way. So, yeah, it's a little warm out today, definitely. And but we've got some great guests coming today. We've got our Partners with Prizes, Brandt, who is also a volunteer for Caregiver Volunteers. And we've got Dina Coffee, who, listen, Dina is, I know she is here for the Alzheimer's, but we got to talk. She's also a dancer. I mean, this was a dancer, a two-time dancer for Dancing with the Stars. Awesome friend. And then we've also got, who's our doctor that's coming in as well?
Dr. Patel just walked in.
Oh, excellent. We're going to get you up in a little bit, so hopefully we can give him a little bit of a break. But Alzheimer's Awareness episode, I'm really excited for this episode. And I hate to say, this is the one that all of my friends were like, listen, I have questions you need to ask. Because I think that it's one thing we all know about. When I say about, we've heard it. We've heard Alzheimer's. We've heard about.
And we all know somebody with Alzheimer's.
Right.
And dementia.
But we don't know what that first sign, what do you do? What is it that? And from our standpoint, like when your parent, if something's happening with your parents, was it a UTI or is it something you really need to look into? And what goes into all of that? And once you do diagnose, then what? What steps do you follow? How do you make sure that your loved one is taken care of? And also, how do you mentally be able to put up a shield to move through it, right?
Exactly. Well, I think Dr. Patel is going to be able to answer every one of those questions. I mean, he's been doing this for over 30 years, I believe, and he diagnoses and he does research also, which is amazing. So,
well, it's gonna be fun. I'm so happy to have you back.
Yes,
I feel
thank
so
you.
Sharon was awesome.
Yes.
Of course, I felt horrible because I just had like verbal diarrhea and didn't even let her talk the entire time. Which, yeah, that can happen.
Well, we all know that, Bob.
Well, so I think we better get this thing started.
Absolutely.
So we're going to take just a second. We're going to get our first guest up here, Dina Coffee. And yeah, guys, welcome to The Scoop. We will be right back.
You're listening to the Senior Scoop with Bob and Maria. Thanks for joining us, and we will be right back.
It's time for the Senior Scoop with Bob and Maria.
We're back, everybody.
Yep.
So we are back, and we're here with our guest. And it's always fun with this show because we do get to meet some people that we've become friendly with and are friends with. But when we do the research, I get to learn a lot about them. And I was jazzed to learn this about you. So this is Dina Coffee. She is from our Complete Care of Homedale and Whispering Woods. She's a certified dementia practitioner with over 24 years in experience in healthcare. She started her journey in the dining room staffer before she got through this. We're going to get into that.
Yeah.
Most recently, she did take on this dual leadership role as the Senior Director of Sales and Marketing for both Complete Care, Homedale, and Whispering Woods. But you've also been a huge part of the Longest Day, which we're going to be talking about, and the main reason that you're here. Mm-hmm. So we want to welcome Dina Coffee to the stage. Welcome.
Thank you.
Now, Dina, you were a two-time dancer.
Yes.
Dancing with the Stars. And
2 times.
I thought you were amazing. In the last one, there was twirling going on. There was a lot.
I
you
was
had
Barbie.
props.
I was Barbie.
Yeah.
So wait, we go out. So Dina comes and it was your son, right? Your son came in.
My son carried me in.
So I'm coming in. I'm like, we're getting everything ready for the thing, and I'm in Tucson. So Dina gets there in a truck, and they've got it was a hand cart.
Mm-hmm.
It was a hand cart. Mm-hmm. I'm like, do you need to bring stuff in? No. This is the prop.
Mm-hmm.
So, what do you mean?
Mm-hmm.
Well, if you had seen this, Dina got wheeled in. She was a perfect still Barbie. It was an awesome dance, and
We had a lot of fun.
yeah, you know, the only reason you haven't won is we're hoping you can do a third time.
Yeah.
Look at that face.
My partner was like, "No, we're not doing it," but I could probably convince him.
I'm sure you could.
I think so.
But no, we are here with this month. We want to talk a little bit about the long stay. Now, you actually did something. What was it? A cornhole tournament
We
you guys
do.
just did.
Yes.
So tell us about that. What'd you do?
So with my fundraising for my various teams that I've been on with Artist Senior Living, where I started it about 4 years ago, is that on the longest day, we do a cornhole tournament. And we have teams, healthcare teams, families from the community, families or professionals come in, and they have a team, and it's a minimum donation, and we play cornhole. And we used a local company. Fun Bags brought all they're awesome. They brought all the setup. They brought the iPads. They were able to do the whole scoring and everything. So it was a lot of fun. And we raised some money and we have fun. And this year we also had a little band. So it was nice.
Cool.
Nice.
Yep, we had a good time.
That's a really good company too. What's the owner's name? I forget. Eric. I threw over there when they first opened.
Yes.
I was throwing bags.
Yep.
Yeah, that's a great spot. That's
Yep.
awesome.
So he's mobile, so he can bring all his stuff wherever. So he's really good, and he guides everyone and tells you how to do it and how to keep score and everything. So it was fun.
So 24 years you've been doing this. You started off so tell me how did you go from the wait staff to this? How did that all happen? What happened?
So for the last 20 years, actually not in the last 10, but I pretty much had like a dual career. I was in catering and food and beverage.
Right.
So my start years ago was at the Office Lounge right here in Toms River.
Oh.
So I was a manager, a bartender, a server, all the things. Had my daughter. Then went into catering a little bit more and was working out in Princeton, was working in Belmar. I used to run individual catering halls, and I was a
wow.
director of catering. So I did that for quite a few years. And then my son was born, and I was like, okay, I really need to dial this down a little bit and stop staying out till 2 o'clock in the morning at different events. I need to be home. So I found a job at Crestwood Manor as a dining room manager. And then from there, I went over to Leisure Park and was a dining room manager. Was there for about a year, and the executive director said, you need to apply to be the independent living administrator.
Oh, wow.
And I did, and that was its history from there. Yeah,
Well,
exactly.
I will tell you,
So-
the one thing that I know about you, Dina, is that you're just an amazing advocate for seniors. You've really been in this field a long time.
Mm-hmm.
I mean, and what you've given to caregivers too. I mean, the dances and the support has been really phenomenal. So I'm really excited that you're here. I'm excited that you're back in, with Complete Care, which we get to work with once in a while. Homedale's a cool area. Where do you
is.
live though? Are you down here or down
I
there?
live in Toms River.
Oh,
Yeah.
A little bit of a haul.
A lot of audiobooks and yeah.
That's crazy.
Yep.
So, but tell us a little bit about, how this, so I understand how you got into senior care, but when we talk about Alzheimer's, when we talk about dementia, how did that road happen? How did you get so involved with that?
So I think it was probably 2018 or 2019. My dad was diagnosed with mild cognitive impairment. And from there, it just kind of took me on this whole path of getting involved with the Alzheimer's Association and figuring out how I can give back and how I can help. And a good friend of mine, Alex Mata, and I were the committee chairs back in, I think, 2020 during COVID. So we just kind of took it from there. My dad wound up having Lewy body's dementia, which was just needs a lot of support. All the dementias need a lot of support, but it just taught me that there are outlets out there. So I just became a huge advocate of what they do. Alzheimer's New Jersey also, both of the organizations raise funds and help people, and there's support, there's research, there's advocacy for different things locally and federally to be done, and I just found it so interesting and still do. So I just threw myself into it. This year I'm the executive committee chair again of the Monmouth Ocean Walk.
Oh, wow.
So, yep.
And
So
when
tell me
is
about
that?
that.
Yeah,
What is
when's
that?
that?
So Monmouth Ocean Walk is Sunday, September 21st in Bradley Beach. It takes in all of Monmouth and Ocean County. Folks can create a team, go on alz.org and register a team. Just fundraise. If you can bring your team to the walk, which starts at like 9 o'clock in the morning, there's a lot of fun things going on at Bradley on the day of the walk. It's right on the beach. So it really is a beautiful morning. It really is. We have a quiet tent if you need to bring somebody going through the journey that can kind of hang out in the quiet tent. We have fun. We have music. We have all kinds of stuff. And then we walk about 2 miles, 2.5 miles. Easy walk, beautiful morning, and it raises a lot of funds and awareness.
You know, and it's funny. So, I mean, with you going through this, I mean, one of the things, and I hope, because I like I said, I have these friends that are just in this spot right now, and you know, so there's a moment where the world just changes, right? There's a moment where the world changes, and you don't know who to talk to. First of all, there's the privacy amongst family. Now, you're Irish, not at all.
No. I just married. I just married into the coffee name.
Well, I'm sure it's the same thing. It's we're proud, and the family secrets just kind of keep within the family, and you don't know if it's something to talk about. You don't know where to get that support from. How did you navigate that?
So I will remember instinctively driving from Toms River to Manchester at 2 o'clock in the morning to go and help my mom when my dad just wasn't having it. He was walking around the house, wouldn't lay down, wouldn't do anything that you should do at 2 o'clock in the morning. And being in this industry, in the healthcare industry, dealing with seniors and all different diseases and things that everybody goes through as we age, I found myself literally in tears driving up Route 70 going, what do? I have friends. I have Maria. I have you. I have Bernie. I have all the people in the industry and doctors, nurses. I didn't know what to do. I'm on the road driving to their house in the middle of the night going, I'm going to call this number that I tell people to call all the time. I called it at 2 o'clock in the morning. This lovely woman got on the phone and she just talked me through it. She's like, it's okay, and just helped me through it. I just needed to talk to one more person. She gave me some ideas that I hadn't thought of, and I will never forget that experience. And I got to my mom's and I was on a whole different mindset than I was 20 minutes ago. So it was totally, I mean, at the end of the day, Lewy bodies, Alzheimer's, vascular, all of them, they are what they are. It is what it is. But if you, as a caregiver, can just take a beat and talk to somebody else, and that's what Alzheimer's Association did for me anyway.
And that's the number, so that's who you call.
It's an 800 number, yes. 24-hour hotline. 24-hour hotline.
Wow.
I am
It'll
so
be up
sorry.
on the screen. I'll put it up on the screen.
We'll get it.
So,
But this is for the Alzheimer's Association is who you call?
So Alzheimer's Association is built of 3 pillars: advocacy, support, and research.
Okay.
The support is the walks, the walk to end Alzheimer's, the longest day. Those are all the support portions of the Alzheimer's Association. And then there's advocacy. There's different legislation that's passing to get this to be recognized by Medicare, Medicaid, how you can get things paid for, how you can get blood tests covered and things like that that are needed for early detection, which helps in the long run. And then there's also the research end of it. Research, and we're funding all that research through the advocacy support and through support of the walks and the longest day. So that's the Alzheimer's Association and what they're made of. And those are just a few of the things that they do, but it goes much deeper. It really does. The research is outstanding, and what they can do for early detection is absolutely amazing.
Well, thank you. So, I mean, and you know what? The number is going to be up on the screen right now. We're going to be getting that up. And I mean, so the walk is on the 21st of September.
21st of September.
And if you want a team, what if you just want to walk by yourself? Can you go do that?
You can also do that. And the 21st of September happens to also be Grandparents' Day.
Oh,
so it's,
look at you.
Yes.
Doubling up.
Yes. Mm-hmm. So, wait, I take that back. The 7th is the Mercer Middlesex Walk. That's Grandparents' Day. The 21st is World Alzheimer's Day. Okay. So, yes. So got my dates a little mixed up.
That's all right. That's all right.
And you can go on www.alz.org to register your team. You could show up by yourself. You could walk by yourself. You don't have to have a team. You can join someone else's team.
Yeah.
It's just the support and just the community being together.
And it's during the day, right? It's during the day?
It is at 9 a.m.
Oh, okay. Well, then I'm going to be there.
Nice.
I was talking. We were talking about getting a team. Maybe we can get something with caregivers too. And I mean,
Absolutely.
You know, caregivers. We have a respite program, and it's one of the things that we do is called the recharge, and it's for people that if you have a caregiver. You know, your caregiver can come in and speak to other caregivers, and also the person you're caring for is cared for in another part of the you know, we usually do it at the library.
Yep.
And so these kind of support groups are a big part of it. Support is a big part of this, and knowing you're not alone in any of these things
Right.
is huge. And with that being said, guess what?
Oh my God, a trivia question.
Trivia question.
Game time, baby. That's right.
It's game time!
It's ridiculous. So we play a little bit of fun trivia, some nostalgic things with all of our guests. And today we are going to be doing some decade trivia, but I'm going to be nice.
Okay, good.
I'm going to allow you
I'll
to
help you,
choose
Dina.
your. That's right. Maria doesn't know the answers. I want you to choose your decade. I'll give you the 50s, the 60s, or the 70s.
I'm going to go with the 70s.
I knew you were.
Good
I
girl.
knew you were. Let's see. Now, I will tell you, so far, the studio audience has been amazing at all of the trivia. So they will let you know immediately if you're wrong. Trust me. I promise you that. But let's see what we're going to do. All right. I need some Jeopardy music in the background for sure, so that we can do this properly. All right. 1970s. I'm going to give you this question right here. I'm going to give you two questions. And here's the first one. And Maria, you as well. I'm going to see which one of you guys has this here. Okay. I can't find. Oh, all right. Which 1970s toy could walk down the stairs? Was it an Etch-a-Sketch,
Oh, come on.
a Rubik's Cube,
Seriously?
a Pet Rock, or a Slinky?
Slinky.
Come on.
Does everybody agree? Everybody agree out there?
Slinky.
Listen, I had to start you off with an easy one. I feel good about myself now. I feel good. But now, the second one. Let's go to the 50s.
I didn't say the 50s. I said the 60s.
I don't care. I don't care. This is more fun for me. Now, here we go. So, actually, this is
Our
actually-
audience will help us, right?
This, I think you're going to do fine with this. I really think you're going to be good with that. I want you to tell me, all right, which fast food chain opened its doors in 1955? Was it Wendy's, KFC, Burger King, or the McDonald's?
McDonald's.
You think it was McDonald's?
McDonald's.
What do you guys think? McDonald's? Hands up if you think it's McDonald's. Who thinks it was Burger King? Who thinks it was Wendy's? Who thinks it was the other one, which it can't be because I forgot its name already?
KFC.
KFC? Who's still around? Everybody good? You ready? It was McDonald's. McDonald's, that's right.
Mickey D.
So you did 2 for 2.
I did.
You're the first guest that ever got 2 for 2, which means I got to give you one more. Tough
Oh my
one.
God, I knew that was
That's
coming.
right. No, actually, no. What this is guess the price. Guess the price. Yes, this is a fun one. There's just one more game for you. We're gonna play this. I want you to tell me. All right, now, a 1 pound bag of M&Ms right now at the supermarket can run you between $5 and $7. Now you wanted the 70s, so we're gonna go with the 70s. In the 70s, would you say you could get that same 1 pound bag of M&Ms for the whopping price of $2.99, $1.99, 75 cents, or $3.75? $3.75. What do you think, Maria?
$2.99.
$2.99. What about you guys out there? Let's just see the hands for the what was it? $2.75? Is that the one we were thinking?
$3.75.
$3.75. If you thought $3.75, all right. If you thought $2.75, anybody? Well, guess what? Believe it or not, things have changed because the correct answer is 75 cents.
Oh my God.
75 cents. In the
We're just all
50s,
conditioned.
in the 50s it was 52 cents. In the 60s it was 63 cents. In the 70s, 75 cents. But today, baby, $5 to $7. Isn't it
Wow.
great?
great.
Well, ladies and gentlemen, a big round of applause for our guests. Thank you so much, Dina. Thank you for being here and talking about it. And we'll talk about the 21st. We'll get that number up there.
Awesome.
We'll see you again.
Thank
Thanks,
you.
everybody.
Thank
We'll
you.
be right back.
You're listening to the Senior Scoop with Bob and Maria. Thanks for joining us, and we will be right back. The views and opinions expressed on Senior Scoop with Bob and Maria, presented in partnership with Caregiver Volunteers and Harrogate, are for entertainment and informational purposes only. These views do not necessarily reflect the opinions or policies of Caregiver Volunteers, Harrogate, this station, or their affiliates. The content provided should not be considered medical, legal, or financial advice. For personalized guidance, please consult with a licensed professional. Listener discretion is advised.
It's time for the Senior Scoop with Bob and Maria.
All right, we are back, everybody. And our next guest today, this is Dr. Ashok Patel. And with over 30 years of experience in clinical geriatric psychiatry, Dr. Patel has been one of the principal investigators on more than 100 clinical trials covering everything from Alzheimer's to Parkinson's, migraines, and depression. He completed his fellowship at Cornell University Medical College, later went on to teach there as well as a teacher at Robert Wood Johnson Medical School. He's got a couple awards, 2011 and 12. You got the Alzheimer's Association New Jersey Chapter Humanitarian of the Year Award, as well as the Arnold P. Gold Foundation Award. Ladies and gentlemen, our guest, Dr. Patel.
Thank you.
Welcome.
Thank you.
So, well, we do want to thank you for being here, and we've got a lot of questions for you. So, what got you into wanting to learn about Alzheimer's? What made you choose this field?
It began way back when I was at Cornell. At that point, it was about 35 years ago, and there was not really much known about Alzheimer's. So I had a professor, Dr. Gold, and he said, why don't you look at these? And in those days, we just did evaluation and tried to figure out what's going on. And we collected data on those floppy disks, if you guys remember. And we had people coming from all over the world because they were concerned about their spouse or parent, and they would come and say, this is the best place to get evaluated. So in those days, we just did evaluations and collected data. Fascinating at that point. This has nothing to do with now, but we were doing very strange things because we didn't know much at that point. We knew what the brain looked like. So when you look at the brain of an Alzheimer's person and the Down syndrome, you guys have heard about the Down syndrome, So when you look at those brains, they look similar. So, they have very, very similar pathways too. So we were at that point looking at like fingerprints, because in those days, the Down syndrome had a unique fingerprint way of, presenting. So we thought maybe we'll look at Alzheimer's. We didn't know anything, so we were fingerprinting everybody. Wow. And we were looking at if there's a fingerprint analysis we can do.
Yeah.
So we didn't find much, but there was some relationship. I'll come back to what is called a coincidental relationship and really a scientific basis.
Okay.
So many of the studies we say, we looked at 1,000 people, and if we are using aluminum foil or something, you got Alzheimer's, okay? That was the theory floating some few years back. Mm-hmm. So the difference is a coincidental finding is something like, let's say if I go to New York on a Thursday and there are 10 murders, and unfortunately you go on Friday and there are 20 murders.
Okay.
So they relate, when he went, there were 20 murders.
Oh.
So that's a coincident finding.
Okay.
When you look at thousands of people, you will find some coincidental things that were common to some of the people. But that doesn't mean that's the cause. You didn't kill those people, neither did I.
Oh.
But it looks like on paper that he was worse murderer than I am. Right?
These are great examples you're giving us, Doc. I appreciate this.
So that's a coincidental finding. And in science, we kind of eliminate those coincidental findings, and we need real proof.
Yeah.
So we go on theories. Let's say there's a theory that says maybe in the brain the circulation is not so good, so you're having a dementia. So we had this, idea in those days. If I go on too long, just stop me.
No, I'm loving it.
Yeah. This is 35 years back, so we got 30 more years to cover.
Better make a call, Bernie.
So the cardiologist and the vascular people came in and said, something must be wrong with the brain circulation. So we said, how do we find out? So they said, those who have poor circulation have less hair in their nose.
Oh, gosh.
Okay. So our research project said, let's count the hair in the nose. And we said, look, we are residents, we don't want to do this. We are not going to do this. So they gave us an alternative to count in the ear. A little bit better. Let me put it that way. And there were no sophisticated AI or, photography and that kind of thing. We did find some coincidental relationship between circulation and hair in your ear. So please don't go home and start counting hair. That's not what I'm recommending.
That's funny.
But those were the type of early studies we were doing. And what happens is, technically Alzheimer's is when the nerve dies in the brain, it forms a plaque. So when you look under the microscope, there are two main types of plaques. The one in the frontal area is called amyloid plaque, and one in the back or certain other areas of the brain is called tau plaque. So when the nerve dies, it becomes like a plaque. When you look at under the microscope, what Alzheimer's saw in the beginning was that the amyloid plaque looks like a ball of yarn in the microscope.
Okay.
And the tau plaque looks like that, not spaghetti, but that spindly...
spirals?
That kind of pasta. What do you call that? I've got Alzheimer's already.
No, you're saying that like...
Rotelli or...
Yeah, Rotelli.
Rotini? Oh, the little twist.
Yeah.
The little
Twisty
twisties.
thing.
Yeah, we call them twists. I'm
All
Irish.
right.
That's right.
So that's what the tau plaque looks like that under the microscope. So incidentally, Louis Alzheimer's had a birthday on the 14th. June 14th was his birthday. Anyway, so he saw this under the microscope and he called it dementia, just dementia. He didn't have the words for it. And other people then said Alzheimer's dementia. So that's how the name came around. He was the first one to see the plaques under the microscope.
Wow.
And the same plaques you see in, people who have chromosome 21, that's the Down syndrome. So you see the same plaque in Down syndrome. So we were doing all this research and we look for how to reduce this amyloid plaque. Last 30, 35 years we've been doing the same thing. Very hard to figure it out.
Yeah. Is it one of these things? Is it like if the plaque was removed, or is the brain getting damaged, or is the plaque blocking? Like what?
You're right. So when you get older, all of you, your brain shrinks, right? But does your skull shrink? No. So if the brain shrinks and the skull doesn't shrink, how does the brain not rattle inside? You understand what I'm saying?
Oh, okay.
The skull is made kind of steel, but inside the brain is shrinking. So if you shake, it should rattle because it's become smaller. So what happens is inside there are balloon-like things, and they fill up with liquid or fluid, which will keep the brain intact, so it doesn't kind of shake.
Okay.
Right. So when you look under some of the scans, when the brain is kind of damaged or shrunk, you will see big ventricles, as we call it, big black balloon-like things. So that's what we see fairly commonly. But that's Many people have brain shrinkage but don't have Alzheimer's. As you get older, there's more fluid in the brain. But not everybody who has big ventricles has Alzheimer's. So now when the plaque occurs, the goal of any treatment would be to remove plaques.
Yeah.
Right? But first you got to find out if there is plaques. So that's where half of the journey took place. How do we, in the beginning, we didn't know how to look for plaques unless the person was dead and we do an autopsy and look at it.
I see.
Till then, there was no way we could find plaques in the brain.
Oh. So it's not visible through a scan or anything?
No way, it wasn't.
Wow. Oh, it wasn't.
It wasn't then. So how do you find something like that? So over the years, there's something called a PET scan, PET, PET scan. So the way basically PET scan works is you have an active radioactive substance and you inject it, and that radioactive substance is very specific. It's like a jigsaw puzzle. It will go and attach to the other side of the puzzle.
Oh, okay.
So then it lights up on the scan. So each jigsaw is different. So for example, if you have a plaque or a cancer in your lung and you do a PET scan, you need that particular piece of jigsaw to match with that jigsaw.
Oh, wow.
So, that fits properly, then it lights up.
See, this is great because I will tell you, I'm sure a lot of people, you're like, well, why can't you figure it out? Like you go
Right.
in, you should just find it.
Right.
You actually have to have a couple clues before you can get there.
Correct. And it has to be radioactive.
Oh, well, this is getting real good now.
So, it has to light up on the X-ray machine,
Oh, wow.
not just attached to it,
I
but
see.
it has to light up. So for lung cancer, there's a different tracer. For the amyloid plaque, there's a different tracer. For the tau plaque, remember I said there was another one? The Rotelli kind? There's another plaque.
Oh, wow.
So you have all different kinds of tracers that detect this. So now, about the last 5 to 10 years, we have had this PET scan. And now what happened was they began to they were looking at blood samples to see if there's a breakdown of this plaque, to see if there is a correlation. So they were looking at PET scans and then looking at blood markers, how much is connected, how much is there a relationship. And you have to prove that there is a relationship. So you have to do thousands of studies to make sure that whatever you see on the PET scan relates to the blood test.
Now, is the journey, is the hardest part figuring out what type of, where a person is in their journey, or is it once you have it? It sounds like if someone comes in with signs, right, you're still trying to find out what type of dementia they're going on before you can try to treat it, or is it? Is it all a
Absolutely,
puzzle?
yeah. First, you've got to. Dementia is a global term. As you get older, your brain functions change. So what happens is you can't do multiple functions at the same time.
Okay.
So if you're driving, you can't listen to the radio and then put a signal and be careful of what's going on.
Really?
One task is better done than 3 or 4 tasks together. So you got something to look forward down the
I
line.
was going to say, I'm already there, so I don't know what you're talking about. I can't do any of that stuff together. Forget about it.
So, but the other side of the brain, brain is like, how would I say it? It's like, your car battery. There are no wires. There are 96 billion, with a B, neurons in the brain. Okay? We can't even figure out what a billion is. Now, 96 billion in the brain, it's very hard to figure out where what is. It feels like a jello. Sorry. And when you see all these plaques happening slowly and steadily, there are 2 types of genetic tests we do. One shows that if you have both parents with Alzheimer's, that's called ApoE genetics, then there is much higher likelihood that you will have Alzheimer's.
Okay.
The other type is when one parent has it, then there's less chances.
Doctor, as you know, learning about it, understanding it is one thing. Like living through it as a child or as a husband or a wife, when you start to see these first signs, right, from the person who has the dementia, when they're going through an episode, do they know they're going through an episode, or is it really afterwards you're telling them you have something wrong with you and they can't understand it?
It's both. So in the beginning, the person does recognize that they have memory issues. What happens is, normal aging, you do forget things, but then you recall it. Then you remember. If you really sit and then figure it out, it will come. For early dementia, that never comes, So, and what happens is the same memory problems get repeated. So, for example, if you go shopping and you park your car, right? Occasionally you'll forget. But these days, if that happens often, then, there's some issue with remembering things. Nowadays, it's not a great thing because you can do the chiching and your car will find you.
Right. Yeah.
So it's not the best test, but what my point is that whatever you're forgetting, simple things, keep on repeating. Where did you put this thing? Where did you put your checkbook? Where did you put your glasses? So it keeps on repeating that kind of a way that it happens more frequently. So there's some kind of a signal that something is not right with my memory. But most people want to avoid it, say, I must be getting old and things like that. Then at some point, they'll get in some kind of trouble, Some of the tricks happen, like when I go home and I put my keys somewhere, right, car keys. Next morning, I don't remember, I forgot. So the first thing I do is yell at my wife, where did you put my keys? Okay? So what I'm doing is getting paranoid that somebody took my keys. So memory, when you don't have memory, then you begin to make these assumptions,
right.
Or then it progresses much further. The second thing is that as it progresses, they forget who the person is, or begin to get very suspicious. If their spouse is not around for an hour or two, they think they're having an affair.
Oh, I see.
So that's not unusual. For us, when I teach medical students, I tell them, if there's a woman who says her husband is cheating, if she's less than 65, she's right. If she's over 65, she's wrong.
I don't think you've been to some of these developments yet, Dr.
Right. But I think because they cannot identify people in their house, they get paranoid, they get agitated, saying, you're not my spouse, or, So you mentioned something, how about their family? It's devastating for them because they see a person who's very different from what the person was.
Right.
The personality changes, the whole behavior patterns change. So right now, as we stand, the Alzheimer's is kind of divided into two major sections. One is early part, where we're trying to detect it and treat. And the second one is where we get these secondary problems because of these memory issues. They get confused, they go in and out of the house, they change their clothes 5 times a day, they wake up in the middle of the night instead of trying to get to work. All those kind of behaviors begin to kind of escalate. And so majority of the research is being done in that section too.
So what do we do with the medication? What does it do physically? Like, what kind of medications are out there, and what are they doing? Because you've explained there's that space up there, that plaque's there. There's no surgeries taking that out. So is it a shrinking of the plaque? What happened?
So we have they've been working on this plaque forever and forever. So what happened was, remember I said about the PET scan, and then they were looking at the blood products of if the amyloid breaks down in normal people. So then they found that they can now do a blood test. Now, the PET scan costs $4,500.
How much?
$4,500.
Wow.
So just last about 3-4 months, we've had a new blood test that we can test that is similar, measuring the amyloid and tau in the blood.
So through a blood test now they're almost there, or they are there?
So they are there. Medicare is a pain in the neck. They don't want to pay for it, want to pay for it, and all that happens.
Yeah.
But it is available, and I would say because it's new, 99% of the physicians are not still familiar with it.
Sure.
But it will come by another 6 to 12 months. It will be much more common that we can do a blood test. So
That's awesome.
when we
great.
do the blood test, first we are looking at this genetics.
Okay.
Whether that's ApoE4 is the genetic profile that we are looking at. And then the second one is we are looking at amyloid and tau protein in the blood. So it's a little bit easier now.
Yeah.
But the caveat is very little weird. So we have like 50 people here, and assume nobody has Alzheimer's. If we did a PET scan for all these people, about 10 will have plaques, but no dementia.
Right.
So it's not 100% accurate test.
Okay.
It's 90% accurate test.
Yeah.
Okay, so it's still fuzzy, but that's why we do complex memory testing in the office. Paper,
Okay.
pencil. We get history. We see how they've been at home. What are they doing at home? What kind of work they're doing? And to figure out, I give a simple test that anyone can do. If you're over 60, you pick a letter, put your timer on, set it at 60 seconds, 1 minute,
Okay.
and pick the alphabet letter and start the clock and write down whatever comes to your mind from that letter. So
So how many words?
how many words you can write?
I think we should
1
all do
minute.
that.
I know. I want to. Can we try this? We don't have paper and pen, but I'm intrigued. So you take a minute. You think of a letter. So if I thought of the letter B.
Except the F letter. Don't think the F letter.
You read my mind, doctor. So you start with a letter, and then you have 1 minute. You write down as many words as you can that start with that letter.
Correct.
Okay.
You can take B, S, F, whatever you want. Not F, but any others. So when you take that letter, this is a very broad test. It's not very specific,
Yeah.
but very easy to do. And you then calculate how many words you got in 60 seconds.
Okay.
So, look, if you got less than 8, you're dumb. You should go see somebody. Okay.
That's not dementia. That's grade school. I got you. Okay.
But the way we calculate is you should have the number of words equal to the number of years of education.
Oh, interesting. So I need like 4 or 5. Oh, from kindergarten. Oh, no.
You can skip kindergarten.
What if you took the same class twice? Like if I stayed back, do I need that one? Is that I'm trying to figure out what I need here. I need an easy letter. I'm picking S.
So I think that gives us a clue. It's not like an exact science, but if you're really struggling with that, then you need to figure out, are there more things in memory that you're forgetting? You're paying bills. Do you forget paying bills? So there will be signals.
Yeah.
Many signals. And initially, the person will say, no, I don't have a problem. I'm just getting old. Then after a little while, they will recognize that they do have a problem. But that window is short. If you have Alzheimer's, that will move to, I don't have a problem. And then it will remain forever.
Oh, wow.
So the Alzheimer's is not like short illness. It's an average 15 to 17 years of illness.
Wow.
So from first diagnosis to the end, we have a long time.
Yeah.
So there's no urgency, but the earlier you detect, the better off you are.
Well, like I said, my friend it was very important. So his mother-in-law is, most of the time, she's doing very well, most of the time. But then there are moments where, I mean, for a week straight, every morning dressing for Thanksgiving, thinking it's happening.
That's there.
Yeah.
So that type of confusion is there.
Yeah.
Earlier you asked about sundowning, or
Yeah.
that happens more on the lower end when they get much worse.
Okay.
The clues are much less. Sundowning means the lights are less, and in the evening they become more agitated.
Okay.
So that's more common as you go down, and it's very devastating for the family members or caregivers.
Yeah.
Because then they become aggressive and argumentative, and asking the same questions again and again, and all their behaviors intensify.
Yeah.
Coming back to those plaques, now we have 2 new medications that are IV. They're given every 2 weeks or so in the office. Now what they do is they remove the plaque.
Wow.
So it's an interesting phenomenon. It's because it's an IV, it will reach the brain more efficiently. We don't have any pill that would make that happen. And those are called monoclonal antibodies. So remember that the tracer I talked about that was radioactive that goes and attaches to the plaque?
Mm-hmm.
This one, the monoclonal antibody, goes and attaches to the plaque too.
Okay.
And then it distangles it, kind of removes it. So it's like a scab. When you have a cut, you have a scab.
Mm-hmm.
Right? So if you can remove it smoothly, it's nice.
Right.
But if you remove it too fast, it can bleed a little bit. So you could have a microhemorrhage here and there, So that is why we have to do MRIs every few weeks to make sure that doesn't happen. So there are some drawbacks, but right now,
But that's a cure. Is it? Are you seeing like curing effects or just stalling effects, or?
right now I would say, if you catch like early, right?
Yeah.
Just parking in the wrong place all the time, can't figure it out, all that. But otherwise, everything looks okay. We do the PET scan, it shows up a minimum on the PET scan, you have to have 6 different areas to show plaques, not just one area. So they show 6 different areas, and then we start the drug, it will make it remain the same.
Okay.
So not go down the 17-year path,
Yeah. Yeah.
So
Just one of those damage is done type of deals, right?
Right.
Yeah. What's
You
done, you
can't-
just
yeah,
want to stop it.
right.
You want to stop it and hold it
you
back.
can't kind of make it better.
Yeah.
Not yet.
Not yet.
They are working on
Sounds
it.
like you're making some strides, though. I mean,
Yeah,
things are
that's amazing. So I do have one patient. This is his 4th year on this medication. We do research, so we get the drug much earlier. So last 4 years I've been treating him, and he's remained pretty same
Wow.
for 4 years, to the point that he even got the confidence that he got a job. My first patient ever in my life who had Alzheimer's then got a job.
That's great.
Yeah, amazing. So this particular drug, it has drawbacks. Like every medicine has its own side effect profile. But these new medications are IV, they're monoclonal antibodies, and they are available now as infusion. So earlier is better.
Okay.
Later, there's no research. They have not tracked down the line because then it's much more severe. So it's mild, moderate, and severe. So at the mild level, you do see a significant
I have one question. So the monoclonal antibodies, are there different kinds? Because I know they used them during COVID too.
Yes. These are particularly, like I said, remember, they have to attach to the
Okay, so they're
particular
made to
plant.
attach to different,
Correct.
okay,
So that's the jigsaw
Okay.
puzzle
Yeah.
fit.
so there's different kinds to attach to
If
the
we had the
different types of
COVID one, it would be
diseases.
very nice. We give everybody the
Yeah.
and say, no more Alzheimer's. That's not going to work. But
You got job security, is what you're saying. There's a lot going
I
on.
have to
man.
retire
I'll
someday.
tell you, man. I'll
But
tell you.
yeah,
It is
There-
amazing.
It is. It's a very difficult illness, but not difficult to diagnose for people who have been more experienced. You know, if you go to a general practitioner, they'll give you something like Aricept that doesn't work much, and that's about it. But these new ones are much more, interesting and give you good benefit. You have to do a lot. It's not just simple. There's IV setup. There's a lot of insurance stuff. It costs thousands of dollars and all that. But it's definitely worth getting the treatment if they're diagnosed with the Alzheimer's.
Now, do you have a practice? Is there a place that, or what would your advice to a family member, a friend? Where's the first call? Where do they go? Who's the doctor they should look to talk to? Where should they go? Are you open? You got some time available?
Yeah, we have appointments within 2 or 3 days. So we do evaluate.
Where are you? I'm sorry.
Tom's River, right across the hospital.
Right, a mule? Oh, across from the hospital.
20 Mule Road, right?
Oh, 20 Mule.
20 Hospital Drive.
20 Hospital
Hospital
Drive,
Drive,
I'm
right
sorry.
by-
Right
yeah.
across. I can see the emergency room from my window.
Oh, the brick hospital here.
No, Community Medical
Got me all
Center.
confused here, because that's...
Community. So now you got to come for my.
Now you got to go for a test.
Yes. I'm still trying to come up with 5 words that start with B, all right? That's my problem right now. But so what's the name of your practice?
Biobehavior Health.
Okay. And that's
Biobehavioral
right in
health.
Tom's River. You got a phone number?
Yeah, 732-244-2299. Many people are not aware of these new advances and new treatments that are available. Yes, they're complicated, but we have about 6.5 million people in U.S. Who have Alzheimer's, and out of that, less than 20,000 have been treated with the new drug. So there's not that much awareness, and it takes a while for the whole community to understand. And it's always better to do it as early as possible.
Yeah.
So when they have that window where the person thinks, yeah, I got some memory issues, that's the time to get the person in and say, hey, let's do something about
Yeah.
it.
Well, thank you so much for being with us today. I mean, I really appreciate it. I can't let you go without playing a game with you. I'm sorry. It's going to happen. It's game time. It's going to be
Every
short, I
game.
promise. Yeah, right? This one will be short, I promise you that. Now, what I want to ask you this, I'm going to make it very simple. One question. One question for you. Now, speaking of jobs, a lot of jobs that are out there, and your patient actually got a job. I was intrigued to find out, what year do you think it was that the milkman was no longer a thing? Now, the peak popularity was the 1950s, but there was an actual, I'm going to give you the 60s, 70s, 80s, or 90s, where the last delivery of milk actually happened. What do you think, Doc?
You mean the bottled milk?
The bottle of milk, the delivery man, the milkman, that position of a milkman that would go and get the milk. Who out there, I'm just wondering, well, no, you got to lock in your answer first. Hold on, what do you think? What do you think, Maria?
There still are milkmen.
Yeah, there are some.
Well, the milkman, like, they're working for a milk company. These guys actually used to have routes.
Yes,
where they
I
would
know.
buy
I
a
know
route.
what you mean.
Yeah.
But there
so-
still
There's
are.
still some
Are?
They're egg farms. Where do you get your info, Bob? There's
I don't know.
egg
I don't know what
farms
I'm
that
doing
deliver
anymore.
eggs and milk.
Yeah.
Well, then, you know what? Forget about that question. I got a better one. But it was supposed to be the 1970s. I was thinking, all right, but I'm
Sorry.
making it up as I go.
Sorry,
All right,
partner.
No, that's okay. That's okay. I got one for you now. All right, now, how about this one? I got to find one. How about the encyclopedia salesman? Do we
Yeah.
still have them, the door-to-door encyclopedia salesman? Now, I'm going to tell you, I have the year here. I have the exact year that they stopped accepting them. Now, maybe some people are still doing it. They're not making a living, but they're still trying. But I'm just wondering, do you think it was, because I'm going to cut out, it wasn't the 50s or the 60s, the 70s, the 80s, the 90s, or even the 2000s? What year do you think, within those decades, was the last boom of the encyclopedia salesman?
80s?
You're thinking 80s? What do you think?
70s.
70s? Well, who thinks the 70s? Hands up out there. What about the 80s? What about the 90s? What about even 2000? Anybody? Believe it or not, it was 2004. 2004 was the last encyclopedia salesman when they had that last hiring for encyclopedia salesman. But thank you, doctor, so much. Guys, how about a big round of applause for Dr. Patel? We really appreciate it. And we will be in touch. Thank you so much. We'll be right back, everybody.
You're listening to the Senior Scoop with Bob and Maria. Thanks for joining us, and we will be right back.
It's time for the Senior Scoop with Bob and Maria.
Oh, yes, we are back, everybody. We are back. And we've got it's once again, this is a friend. This is awesome to have him here. And not only is Bernie friend, but Bernie was actually part of the caregiver volunteers before I was. How long you been volunteering for them? I'll get into that in a second. So Bernie's here from Right at Home. He is playing two parts today, as he's going to talk a little bit about volunteering. He's also Bernie is an active advocate for the senior community. He is truly a senior advocate that has connections and knows all about the inners and out of home care, as well as the senior living community. Anything you need senior, this guy knows it. He is the co-chair of the Northern Ocean Ethics Committee. He's the co-founder and treasurer of Shore to Give, which is a nonprofit for locals, which you guys know about, and a facilitator to Caring Connections of Ocean County. He is the one and only Mr. Bernie Brandt. Everybody, give him a round of applause. So thanks for playing with us, Bernie. This is great, man.
Thanks for having me.
Yeah, absolutely. No, and we it's kind of funny. So you got to tell me about your. So I get in with caregiver volunteers, and I mean we actually danced the same year back in when.
I was a dancer too.
You sure were a dancer. Apparently, that's like you have to be a dancer to be on our show. That's the way it works. But not only did we dance, but you have been volunteering with Jeff, and you got to tell us about this situation as a volunteer and how you got into it as a volunteer and what your experience has been so far.
Well, yeah, so I started volunteering, about 8 years ago. It's actually over 8 years now. And a friend of mine, Fran Pinello, very active with caregiver volunteers, and she's big with the Alzheimer's Association and so forth. She had a person that she knew that had early onset dementia, and she wanted to connect him with someone relatively close to age that could be a friend and hang out with them. And she thought of me. She did approach me and asked me if I would want to do it. And, I was a little reluctant at first, contemplating, do I want to do this and, share this journey? Because listen, it's Alzheimer's. I know where it goes. You have a bond with someone, it starts to make it hard, especially as the years go on. But I said, you know what, I'm going to do it anyway. Oh. I said, you know what, I met the gentleman, Jeff, and we hung out a little bit, and then it became a weekly thing where I started to see him every week, and then it grew into what's known as Breakfast with Bernie, where I take him out every Friday. We hang out around 9 o'clock every Friday. And rain or shine, we're out there and we go to breakfast. We do the breakfast circuit where we try different diners out. But now, after 8 years, we're actually at the same diner, ordering the same food. And it's gotten there. Yeah.
Which diner? Is it good?
The Lacey Diner. Yeah, no, it's actually really good. He lives in Lacey. Okay. And it is, the Lacey Diner was just bought out by one of the workers there, actually, and they're making it more of a healthier type of food and more organic stuff. And he loves it. He's there a lot of times for breakfast, lunch, sometimes dinner.
Well, it's funny you talk about going out to dinner. I mean, what you guys got to realize is you must have so many costumes in your closet. I have seen you. You volunteered to be Santa. You've been the Easter Bunny. You've been those you tell it. But you've done the Easter Bunny. You've been Santa. I mean, you really do volunteer a lot of your time. You were in a lot of the developments. You've given a lot, man. You're a really good guy, and I mean, I know that you've always been there, looking for what's best for the client. How long have you been with Right at Home, by the way?
I've been with Right at Home 17 and a half years. The Right at Home that I work for, I do all the marketing and business developing for them, and the Right Care Director, actually, the many hats that we have to wear. They've been around for 20 years.
Wow.
But Right at Home has been around 30 years. So Right at Home is international. So I always like to say, listen, we're an international company. You got a big support from a corporate environment, but you got the customer service of a small, company.
Yeah. And speaking of that small company, one of the things, like I know in our office, because we get a lot of calls and people are always looking into, what can they do when they need a little help. And although I know you do the big help where you can help people, round the clock, the little help is, and Julia from our office is always like, call Bernie, because I know that now Right at Home, you guys can do like an hour minimum if needed, right? Things like that.
Yeah, so we still have our pre-COVID type of scheduling available. I know with, after COVID, a lot of things changed.
Yeah.
And, a lot of the home care companies had struggled with, doing those lower hourly minimums, but we were able to maintain, and we still do it. Our minimum is 1 hour, 1 day a week. So it makes a big difference in, let's say the wallet or pocketbook.
Yeah.
And we start them off. A lot of people just need maybe twice a week help with the shower, but they're good with everything else.
Right, and that's a big thing. I mean, because it is. I know from personal experience. We are. You end up paying for a lot of hours, and you know what? It's not even the paying. It's not even that. It's like you don't want it. The client doesn't want it. They just want the little bit of help, and then they want to move on. Like they don't want to feel like they're needed all there.
Right.
So and with the VA benefits too. Now you were talking a little bit before. So tell us a little bit about the different kinds of care, the different kind of home care that you were speaking about.
Yeah. So with we're big advocates for the veterans as well, and we honor all of our veterans, and we're very respectful for them and to them. And when it comes to VA benefits, we really dug into this, and we're like, well, there are some VA benefits out there that a lot of people don't know about. So there's actually 2 VA benefits that will help pay for home care. So there's a medical compensation benefit known as the Community Care Program. It gives you anywhere from 6 to 14 hours a week where they pay the home care company. Not all home care companies are contracted with the VA, so that's why I always encourage people to interview, 2 or 3 companies and see what's out there, see who's the best fit for you. But with a VA, a lot of these veterans have no idea that they can get free hours every week. Now, this is not, lifelong. It could go on for many years, but they have to be reevaluated, I believe, every 6 months. But this is a benefit that they will pay the home care directly, and all they got to do is be assessed by a VA doctor. They have to register with the VA office, and then we help them along with those processes. We work with the main administration building in East Orange, which is in Lyons, New Jersey. And you don't have to go there, but we hook you up with the office, and they'll walk you through the process of getting registered if you're not already in the system. And that's a medical benefit. So that's a different system than the actual benefit system, which is the aid in attendance.
Okay.
So now that benefit is for war veterans and or surviving spouses.
Okay.
And that's a great benefit too. And one doesn't negate the other. So you can, you use both. But with aid in attendance, that is strictly for war veterans, not just for a veteran. So there is a difference. And this one, you don't have to be seen by a VA doctor. You can go to your regular, family doctor. But this also passes to surviving spouses. And I can't tell you how many, family members and surviving spouses have no idea this exists. Plus, with any of these VA benefits, you don't have to pay to apply for them. So there are ways that we can help you to get these applications for free.
Oh, wow.
So that's a really big thing too. So there's never a charge to a VA benefit because they're entitled to it.
Right.
So why have to pay for it if you don't have to? Now, there are services out there that you can, so there is the services, but remember that you don't have to, and we can provide you the ways of getting it for free if you need it.
Oh.
Big deal.
I just want the community benefit. can go to the spouse too, or no? It's
No.
just, no. That's what I
Community
thought.
care
Yeah,
is
it's
a medical
just for the
benefit.
medical, just for the veteran. Okay.
And now, when it comes, I know with the veterans too. I mean, one of the things we had heard now, and this is, I just want to make sure. So, if you are a veteran and you need care, should they call you first? Should they call the VA first? Who should they call?
Well, I would say call us first, because
Okay.
then we can help direct them to the appropriate channels to get these benefits for free.
Well, and that's great because we've had other home care, and sometimes it's called the VA, and so that's great to say.
we handle it, yeah.
Call Bernie.
Call me.
And you know what's so cool? I got to, and it's I understand this world. I mean, I'm one too, and I had the company that I moved through. It's a Bernie right at home. Like that Bernie is right at home. You know this is the guy you're going to be dealing with through the whole journey, through all of it. You've just been with them for a long time. They got a great building there on 88.
Yeah.
And I mean, listen, it's funny because we would not have thought we would be sitting here together. Like when me and Bernie first met each other, and it's just so wonderful to see, what you've been doing. And I do love watching all the Facebook stuff, all the places you go and the things that you do. And you're a musician too, right?
I am, yeah.
Drummer, right?
Yeah, man.
yeah.
He's a drummer. And your kid's drumming, right?
I saw the
band.
stress out somehow.
That's right, yeah. So how's your son's playing? Is that right?
He's playing too, so he's in a band as well, original band. And he started this years ago, then he kind of laid low and he was kind of nervous about it, didn't really want to do it. And I told him, I said, you got such a talent, you got to keep exploring it. And somehow he met up with someone, and he was like, hey, you wanna try out for the band? I'm looking for a drummer. And he's like, okay. One of those, but he stuck with it. They loved him. They loved his playing, and here he is.
Did I see him at the Pony?
3 years later, he's still playing.
He's playing at the Pony, right? Was he playing at the Pony?
Yeah,
Yeah, that's really cool, man.
He played at the Pony. He actually got there quicker than I did.
That's awesome, man.
Yeah.
No, and when it comes to home care, I know we've been learning a lot about it, and one of the big changes that we're talking about, your differentiators are that's the minimum amount and also the first step. So we're right at home. You're wondering where to go. That's your first call. You don't have to go any further. You've got people that have all that experience. The owners are on, like everybody's still right there. So you've seen it all. You've seen it all. You know what to do that way. And if you don't need a ton of hours, you guys aren't going to push them into that.
No.
You have aides that are probably used to those 1 hour shifts.
Yep.
So consistency, which is great. You've got the VA stuff, which to talk to you about too. Anything else? Listen, you are our partner with prizes today, which means this is your time.
Yeah.
What do you want to tell these people about Right at Home?
Well, like the office, the owners are fantastic, and that I have to say. I mean, I wouldn't be there for that long if they weren't. But we have a great retention with our office staff, with our aides, and they're a very good support group. With everybody, right from our owners to the nurses to all the aides that we have in place. And that's why we win awards like the Home Care Pulse Award for being provider of the choice, employer of choice.
That's awesome.
We won the Caring.com Award, which goes strictly by positive feedback for 8 years now. So we have what's known as the Super Caring Award. But these are all reflections of the company as a whole.
Yeah.
'Cause we're just one team. We all work really, really well together. But our mission is to provide the best care that we can to every, not just seniors.
Mm-hmm.
And that is a misconception. Home care is strictly for seniors, but we start out at 18-year-olds.
Mm-hmm.
We have an 18-year-old that needed care, and then we're taking care of grandmom on the other side of the house.
Yeah.
So there is that level of care. So we could take care of 18 and over.
Yeah.
And you'd be surprised how many people in their 20s and 30s and 40s that do need some sort of home care, and sometimes even if it's temporary.
Yeah.
It could be for a few weeks. It could be after surgery. It could be, after some sort of procedure where they can't be left alone, or they need help in the shower, whatever it is for that personal care. You could call us, and that's what we do. We help you, and it could be temporary.
Well, it's funny you say that, because I think that's one thing to get across to folks too, is that home care, if you're in the field, it just might not happen, right? Like, don't be afraid to make the call and get it going. Like if you wait too long, or if you're really behind the 8 ball because you were afraid, like, do we really want to trouble these people? That's part of it. Like, that's part of the gig. So Get the information. If you don't know, you don't know. And am I wrong, or were you guys accredited before you even had to be? Were you following along those lines? You were, right? You guys, yeah.
We were accredited way before that law came out.
Yeah, that's what I thought.
Yeah.
And accreditation, for those of you who don't know, so home care, to have an agency, a lot of people just think of it as a staffing agency. But there's a lot that goes into it. When you have a home care company, I think it was it was right when I started. It was 2000. I don't even know. It was like 6 years ago, I think. You had to become accredited to have a home care company in New Jersey. And for those of us, that was a major process. It's pretty close to having a nursing facility for what you have to do. But right at home, they wanted to follow that even before they were forced to. And that says a lot about the organization. It really does,
Yeah, we wanted to figure out, are we doing the right thing? And if not, can we correct it? But what's the best way to serve the community?
Yeah.
So that accreditation did help a lot because, there's a lot of regulations that you have to follow with that accreditation company, plus the state regulations. So they kind of keep you in check.
Oh man. Well, yeah. If you have any questions, I will tell you, I actually really appreciate Bernie for what he's done. And I mean, when we were doing these things to learn about how much he cares about the clients he has, the caregivers he has, the organization he's part of, through the growth, through all of it, even through COVID. I know I would trust you guys 100%. And so I thank you for coming here. But now these people want one of your prizes, all right? So first things first, I got to play a game with you, Bern. And then you're going to give away a prize.
There you go.
So here we go. It's going to be game time.
Oh, no.
Game time. Oh, yeah, it's game time. But we're going to go back to trivia. And I'm going to ask you, do you want 50s, 60s, 70s, or 80s? I'm going to give you 2 questions. Let's see if you can do as well as Dina.
What's the topic?
Oh, I'm not going to tell you the topic.
Come on.
I'm going to pick the hardest one of the group.
50s, 60s.
50s,
All right, let's
60s.
go with the 80s.
80s. Oh, I love it. 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 I didn't even give you the choice of 80s there, Dina.
Yeah.
All right, now, here we go. All right, let's see here. Too easy, too easy, too easy.
Make it easy. I'm not good at this.
Too easy, way too easy. Ooh, here we go. I like it. What toy craze involved small, colorful figures with spiky hair? Was it A, Beanie Babies, B, Troll Dolls, C, My Little Pony, or D, Care Bears? Now, before you lock in, we can see how the audience feels. I just want to get an idea. Audience, do you think it was Beanie Babies? Hands up. Do you think it was Troll Dolls? Hands up. Do you think it was My Little Pony? Hands up. Or do you think it was Care Bears? Hands up. Oh my gosh, I like it. Now, Bernie, you've seen what the audience thinks. You saw Maria's choice there, maybe. What do you say? Was it Beanie Babies, Troll Dolls, My Little Pony, or Care Bears?
I got to go with the Troll Dolls.
He says Troll Dolls.
I got to go with the Troll
And
spiky little hairs.
That is correct.
that's right. That is correct, Bernie. You got the right one. It was the Troll Dolls. And, believe it or not, My Little Pony also had a spiked hair, but not as well known as the Troll Dolls, as per ChatGPT. So, all right, one more question, and we're going to go to the 50s to really screw them up now.
Atlantic City after
This is the Atlantic City question. All right, let's see here. Ooh, you might get this one. You might. Okay. What was the name of the first color TV show broadcast coast to coast? Was it The Ed Sullivan Show, B, Bonanza, C, I Love Lucy, or D, Dragnet? In the 50s, what was the name of the first color TV show broadcast coast to coast? Let's see what our audience thinks. Audience, do you think it was The Ed Sullivan Show? A, raise your hand. Do you think it was Bonanza? Raise your hand. Do you think it was I Love Lucy? Or do you think it was Dragnet? Raise your hand. They didn't help you much at all. That was a split audience. This is a tough one. Maria, what do you think? Just wondering.
Oh, that's a really tough one.
It is.
I remember them all in black and white, so I'm
Right.
Yeah. So I'm gonna go with.
Yeah.
I know. Then they did do Lucy. They redid it in color.
Ooh. So once again, we got.
I'll go with Lucy.
All right. So I Love Lucy is your C. What do you think there, Bern? We got Ed Sullivan Show, Bonanza, I Love Lucy, or Dragnet?
You know what? I'm going with Dragnet.
Dragnet. You know what? You better warm up that car, baby. You better warm up that car because after this, you're going to be going right to your house. Because, I'm sorry, my friend, but that is incorrect. The answer was Bonanza. Bonanza. That we had a couple hands out there with Bonanza. Wow. Ladies and gentlemen, we want to thank all of our guests today, all of our guests that came out to hang out with us. Dr. Patel, Dina Coffee, and Bernie. Now, what are we going to be doing next week there, or next month?
Next
Marie?
month, we have summer safety tips, and we're going to have an ER doctor from Community Medical Center, and then we're going to have an update on the expansion of Community Medical Center, and we're going to have the VP of Operations, Neil Bryant, coming over.
We'll see you all again, and you can check it out on seniorscoop.org, or you can see it at Harrogate or on YouTube. We'll see you all again. Thank you to all of our guests. Good night, everybody.
Time for the Senior Scoop with Bob and Maria.